Now, the Ministry of Health is on high alert following an Ebola case reported in Mbale City in eastern Uganda, which is less than 70 kilometers from the Malaba border. The measures include heightened surveillance at entry points with a designated parking spot for planes arriving in the country from Uganda. The public has been urged to be extra vigilant, even as the government liaises with Kenya Medical Supplies Authority to procure adequate supplies, including protective gear, in readiness for any eventuality. As of Tuesday, Uganda had 9 confirmed Ebola cases.
According to the Health Director General, Dr. Patrick Amoth, the threat of Ebola is now closer home.
With one specific case in Mbale City in eastern Uganda, which is less than 70 kilometers from our border in Malaba. Therefore, the threat of Ebola is real.
To this end, surveillance has been heightened at entry points.
Especially the land ports of entry, that is Busia, Malaba, Swam and Luahaha, but also at Jomo Kenyatta International Airport. And we have a designated parking slot for flights coming from Uganda.
The Ministry of Health is also working towards capacity building for health workers and procuring protective gear.
We have the laboratory capacity that we used during COVID-19 pandemic that we'll be able to latch onto. And we are working together with KEMSA and the county governments to be able to ensure that we have sufficient stocks of personal protective equipment, because you need a unique PPEs for Ebola.
According to Dr. Amoth, capacity at the Kenyatta National Hospital in Nairobi and Moi Teaching and Referral Hospital in Eldoret will be enhanced to handle any Ebola cases. In neighboring Uganda, which launched a trial vaccination program against the Sudan strain of Ebola, 9 confirmed cases, including 1 death, have been reported. Ebola is a deadly disease caused by a virus. Symptoms of the disease may appear 2 to 21 days after contact with the virus. At first, symptoms are generic and are known as dry symptoms. They include fever, aches and pains in the muscles and joints, severe headache, weakness and sore throat. Later symptoms include loss of appetite, unexplained bleeding, diarrhea and vomiting, among others. Meanwhile, the public has been urged to undertake means testing to benefit from the Social Health Authority packages.
The number that has taken means testing stands at 3.3 million, but the number registered is close to 19.4. So we really want to urge you to undertake the means testing process and contribute your fair share.
This comes as a benefits package and tariff advisory panel has been established to guide decisions around SHA uptake. The panel, bringing together experts in health economy, epidemiology, actuarial science and health science, is expected to give recommendations on review of the benefits package within 2 years.
Their mandate: reviewing and recommending health benefit packages to ensure comprehensive care, advising on fair pricing and tariffs for health services, and monitoring the program's impact for continuous improvement.